So Dr. So over to you. But just a few additions. You all have seen him during COVID, and Sir became very popular as Ganga Chacha on Twitter. And the man who was giving out true information about what COVID is and where are we as far as COVID as a pandemic in India was concerned. And a lot of times government servants, when they weren't well equipped with numbers, Sir was the one who was giving us a ray of hope that yes, we all together will get out of this successfully. Over to you, sir.
Since you brought up that issue, Ganga Chacha and Twitter, I didn't know what is Twitter. I'm not very electronically savvy kind of a person. I don't have any Facebook account or you name whatever, excepting WhatsApp. And I was told in the end by people that I'm called as Ganga Chacha. I didn't know. Because most of these people tend to communicate on Twitter. I had no idea. And it's good that I did not know, because then I could focus more on my work. Otherwise you get distracted, know what people are commenting about you. I had no idea what people were saying. So to give you a brief, and this is more for people like you who are into advocacy, policies and issues like that. This you are going to require longer. For us, we have done our bit, and our contributions are going to be minimal henceforward. But it's your life. Everything is in your hand. Each one of us has to contribute in one way or the other. I honestly, I passed out from Jilla Parishad High School in Biloli. Marathi medium. It is not criticism of my teacher, but I used to write in a cursive language in that Jilla Parishad High School. So my punishment in 10th standard was every day I have to submit one page of, like a child writes, separately. But then I stood in merit, I came out, then I went to Dharmabad for BSc, PUC and BSc first year. Like you have 11th and 12th standard, because that was the only science college that was available in that taluka. My father was Tehsildar in those days. Then I was underage, but I got admission in medical college in Marathwada. And I had to wait for 1 year. So my English improved a little bit when I was in Ferguson. Because I wanted to, there was no point in staying at home. So I asked my father that I would like to study somewhere. Since my grandfather was a Fergusonian, I said I would prefer to go there. But when I went there, it was in the month of September. So they had BSc second year, where semesters used to be there. And I had to fight up to Pune University that I can still be admitted. They gave me a warning that you will not get 20% marks of practicals, but are you still willing to go ahead? Because even the examination forms for second year's first semester were already sent, and will you appear for all the papers at the end of it? I said I will, because I had nothing to worry. So I started off. But there I started speaking to some extent, and that speaking was so bad that everybody used to speak in English, all the friends, and then I used to formulate what I should ask or what I should respond. But by the time I could speak, those people moved to some other areas, in discussion. The reason why I'm saying this is I learned one thing, that if you take everything as a challenge, it doesn't hurt you at all. You can fight out. There is always a room to improve, as long as you are committed to do something. I never told in Ferguson that I already had admission for medical college, because my worry was I could be ostracized. No? So one day the letter came home that I have to go and join the medical college. So I just left. In medical college also, there are issues. No? You can adopt shortcuts, because shortcuts can be a part of life. No? For everything you have options. No? I never liked that. I was fascinated by human body, and I continue to believe there must be a God. It can't be no coincidence. No, it's so complicated. It tends to work so much. You get so fascinated by the mysteries of life, and it's like, if I was to put it in simple words, the computers speak in binary language 0, 1. Here everything is spoken in ACTG, only 4 letters, which constitute DNA, which constitute everything. And then the whole thing happens. No, other animals also. And I used to get fascinated that, the same ACTG code, like I said, binary code for computers, can produce an elephant, and then there could be a mice which could be which could be produced by the same code. So I wanted to know more and more. So I never went for shortcuts. I went for the books which postgraduates used to read. The result, I got hit the worst way, because I was not following the tradition of guides. No, these questions can be asked, this will not be asked. And I never wanted to take tuitions, because that was a time when tuition started, which could help you to get into post-graduation. At my time, if I tell today, when our exam results came, there were 27 students who passed out of 100. And those were very tough days. But still, I was not getting full MD. My boss, who recently passed away, both the medicines boss, Dr. Bhagwat, was a legend. He said, I am willing to give you post-graduation seat, but it would be without stipend. So I told him, sir, I cannot afford, because my father is not, he's a government servant and honest revenue officer. So that's a disqualification. Then I took diploma in child health. Now why am I telling all this? Since all of you are young, diploma in child health, if you don't have a MD degree, it's like a handicapped race that you will have to run. Because you cannot be called as a full pediatrician. If somebody comes with a degree, you are gone. But in those days, even doing DCH, you would earn huge amount of money. Then my professor said, don't go into this rut. You have a different kind of a brain. Your aptitudes are different. You join National Institute of Nutrition in Hyderabad. And that's how I went to Hyderabad. And Hyderabad is an ICMR institution, and it was in the first 2 research institutions in the world at that time. But research is something, if you are going to follow your principal investigator, you don't have so much of freedom. I started getting bored with the same. One of the tasks that I could perform was nutritional assessment of all tribals in Maharashtra. And we were asked by then Planning Commission to find out the reason why Madia Gonds, which is a primitive tribe in Gadchiroli and Chandrapur, why their growth rates are falling, because there was a fear that the entire tribe will vanish. So I went to Chandrapur, Bhamragad, Gadchiroli area. It was Naxalite area. I faced all kinds of life-threatening situations when Naxalites try to stop you. or they suspect you that you are a mole. But then I thought, am I doing this work which is going to contribute so much for the society? So then I shifted to Institute of Immunohematology, that is in Bombay, in KEM Hospital on 13th floor. For me, 13th is the most blessed number for me. Everywhere 13th made a difference for me, unlike others as they call. And there my boss said, what would you like to work on? He had only two offers, sickle cell disease or thalassemia. He said, you work on sickle cell disease. Sickle cell disease is a congenital disorder, hereditary kind of a thing, and it tends to occur more often among tribes. Like I walked just now, and when I was breathless, if these people face that situation, you will find that the red blood cells will become sickle-like, and then they create crisis. If you are homozygous, if you have both the genes, the children tend to die very early. If you have one, it is a heterologous kind of a thing, then you are fine. You may survive longer, but sometimes given hypoxic stress, things can be worse. When I started working on it, I said I would love to work in this area because I never wanted to manage all, sardi zukam, diarrheas. No, you tend to get very much bored, no? But you have to show as if you are very interested in there is no challenge. More often than not, it's so routine. No, if you actually see in a government setup, people even don't look up. They just ask question, write down because their accountability there is lower. No, so you don't have to worry. I wanted to fight for a disease which does not have any cure, where nothing much is known. So I picked up sickle cell disease, I went ahead. I established two cohorts. Now for each, this is some kind of a learning, you will understand why I might be telling you all this. I had established two cohorts. Bombay does not have tribal patients who have sickle cell disease. Their numbers are too small, so it didn't make any sense. So if I have to conduct, आपल्याला वेळचं हे आहे का?
हां
वेळ 1 तास पक्का असं असतं का?
संवाद असेल असं काही नाही
नाही आणि मला थांबवाल बरं मी बोलायला लागलो की बोलायलाच लागेल
नाही नाही मी थांबवतो
तर what happened was I had to establish two cohorts. There was one hospital-based cohort in Nagpur because Nagpur has a good number of population for sickle cell disease, and I established one in Valsad in Gujarat. That was hospital-based, this was community-based. And in one of those visits, within a year's time, I was quoted as number 2 in India of work. Why did I tell this? You should not get discouraged. If you fight your way out, even in a city where these patients don't exist, I established cohort, I was focused, I decided to fight, I was known for it. No? But there was a very challenging situation that I had to face. I went for work in the community at Valsad, and when I came back, there is another guy. Incidentally, he got Padma Shree last year, Dr. Italia. No, he used to be our local liaison there for sickle cell disease. When I came back to Valsad after doing field work, he suddenly said, "अच्छा boss, एक काम करना ना आज जाके एक पेशेंट देख के आना." मैंने कौन सा पेशेंट? तो बोला नहीं, उसका गाड़ी आया है, वो गाड़ी से लेके जाएगा, गाड़ी से वापस लाएगा, दूसरे गांव में है, मोटा वाग छिपा करके गांव है, वो गांव में जाके आप पेशेंट देख लो। बोले किसका पेशेंट? तो बोले उसको एड्स हुआ है। बोला अरे मेरे को क्या आता है एड्स मैं क्या करूँगा वहाँ जाके? बोले नहीं, उसको इतना वो ऑस्ट्रेसाइज किया है, वो किसी से बात नहीं कर सकता, कोई डॉक्टर देखता नहीं, कोई कुछ नहीं, तो तू सिर्फ जा क्या? बोला अरे मैं अगर गया तो उसको कौन सी दवा दूंगा मैं क्या, मेरी मालूमात नहीं है बराबर, तो मैं क्या बोलूँगा उसको? बोला कुछ नहीं, तू बेफिक्र जा, बम्बई से डॉक्टर घर आया है, ये उसको पता चला तो वो ज़्यादा दिन जिंदा रहेगा। और दिस इज टू मच। बट आई वेंट एंड to be honest, those days were very challenging days because this is a story of 1988. When I went in his house, he was so happy. No, काय जिना जो असतो ना, तो डायरेक्टली किचनमध्ये जात होता काय मला आठवत नाही आता बरोबर, पण इट वेंट इन टू द डायनिंग टेबल. We sat there, he came out from his bedroom, his wife was also very happy, there were no kids in the house, and he started speaking with me. It was an animated speech. So the entire saliva used to fall on my face, and I was so scared because the only thing I had read about HIV or AIDS, as that time they used to call, was that this HIV virus can be present in every bodily fluid. So potentially any fluid can transmit HIV. The moment I realized this is becoming too much, my legs started shaking like mad, because the fear engulfed me. They couldn't see it because it was a dining table, so I was actually holding my legs, that I might acquire HIV, and then what do I say? Because those days HIV was known as one disease, those who have sex with so many partners, or those who are men having sex with men, something of that kind. So what happened was, his wife asked me, would you have dinner with us? That was far more scary a question. I said, I'm already having a shower of saliva. Now, if you want me to have dinner, so I said, नहीं, मैं खाना खा के आया हूँ, मुझे चाय सिर्फ देना. Because that was my pathetic state of knowledge. चाय म्हणलं की त्याला बॉईल केलेलं असतं, and this virus tends to die at 58 degrees centigrade. So there is nothing to worry. But my legs were shaking so much because he additionally said that he was a bisexual. Now for me, bisexuality was something which was unknown because I was a pediatrics person, so I have never learned sexuality. And then it further increased. I said, this is terrible, what situation has Italy sent me in? I was holding my legs like crazy, and then his wife walked in, and she was smiling with a cup of tea. When I looked at her, I suddenly felt I was like a poor, ignorant person. The first thought that came to my mind, this woman stays with him, perhaps in the same bedroom, they may be having their own sexual life, but she doesn't shake like me. I know everything about medicine, but she doesn't know anything, but she is still smiling. I said, shame on you. And my legs they stopped shaking. From then on, I never looked back. Then I went to Bombay. Dr. Apte, incidentally, he was also a Punekar. He was my director. He asked me, we had to brief him once you come back. I told him the story because in science, transparency, integrity, is extremely vital. Without that, you can't survive. No, you're not a scientific person then. So I told him the entire story. He was suddenly so happy. He said, "Would you like to join the field of HIV? We are only currently testing patients who come to us, but there is no clinical work that is being done." I said, "I will." He said, "Acha, go back and speak to your wife." I said, "Why my wife? No, my wife is a housewife. She doesn't know anything about medicine. I don't ask her unless I am in trouble anything related to my professional life unnecessarily." He said, "Look at me, I am far older than you. I am telling you, you go back and talk to your wife." I went back home. The first thing when she opened the door, I started speaking about what he said. The first response was, "What went wrong? Are you fighting with some people? Are you angry with somebody? You are a pediatrics person. This is an adult disease. Why do you want to work in that area?" So I said, "Everybody says this is not my work. In Bombay, there were only 3 people prior to me who used to speak with patients of HIV or even touch or examine a person." So she said, I said, "If everybody says something like this, no, somebody has to say, okay, I have not been taught because this is a new disease. I will also learn and do things." Next day she allowed me. She said, give me time to think." I had a daughter then. She is now neuroanesthetist and critical care person in associate professor in Tata Memorial Hospital. She said, "Let her sleep and then we will speak." I was extremely worried. I said, "There must be something wrong." And then she suddenly said that you work. I was extremely upset because there was somebody who works in empowerment. No? I said, if she is saying yes only because she is not an earning member of the family, because she has to stay put with me because I am her husband, that is rubbish. I said, I don't want that kind of a response for saying yes. So I said, I need to know the reason before I accept what you are saying. She said, अब हिंदी में बोलता हूँ ना, कारण तो तुम्हें रिकॉर्ड करते हैं. Actually conversation was in Marathi.
We'll edit.
मी 7th floor. I used to live on 7th floor in Nestle, in near Bombay. She said, ऐसा सोचो कि ये घर को फ्लैट में ना आग लग गई. Do you know what will happen? I said, what will happen? The first thing, if you see that fire, you will start running to the lift or the staircase. And when you go at that point, you will suddenly realize, अरे आपली बायको आणि मुलगी तर तिकडेच राहिली मागं. Then you will assess the situation, whether you should go and pick up, how you should go and pick up. So I wonder, why are you telling me this? She said, for every human being, the most preserved instinct is instinct to survive. And if in HIV, if I was to say that don't work, I would be wrong, because you know medicine, so you understand the risks. I should not exaggerate this risk unnecessarily because I am ignorant. I have to trust the self-preservation instinct that every human being has, and then I started off. So there were 2 women who were responsible for me to come into HIV. I loved the field. I was a typical orthodox person. I first went to Kamathipura in 1989. for some function, which was a red light area, no, in Bombay. 1.5 lakh sex workers used to stay in a very small area. ट्रेन के जैसे डब्बे होते हैं ना, उस क्या बोलते हैं उसको, बर्थ्स, ऐसे 8 बर्थ लगाए वाले 10 by 10 की रूम, shabby atmosphere, and the whole thing unclean, unhygienic. They will eat anything that comes to them which is cheap. Majority of these women used to come because that's a typical part of sex work. No? Most of the sex workers tend to be not of recent days, where it is becoming invisible. But those who are traditionally in the brothels, you are more likely to see people from other states coming. So their ability to communicate is very poor. But still they live. And the pimps, the brothel keeper, they are going to earn money. And when they start off their profession, they already have lakhs of rupees for which they will be charged phenomenal rate of interest, and she will continue to pay that interest only. She can never come out of payments as such. I felt ashamed as a human being. I said they are equal to me. It is just that they were born in poor households where they were exploited, where they had to face all kinds of problems. But does that make them less than human beings or likely to be treated more like animals? I said I want to work for them. So I started off. Those days in Bombay, those who used to come for HIV, they were mostly people who were from high income groups. Film stars, I used to know which film star is a heterosexual, who is a who is a bisexual or whatever. That time. But there used to be strict laws. I started working on confidentiality, nobody to speak to one another. I brought that concept at that time because it can be embarrassing for people, and you have to treat your patient also as equal to you. One of the things which one has to remember is you should be as comfortable switching the chairs. Today he is sitting in front of you, that doesn't mean he is lesser than you. If you were to sit there and listen to the crap that you can come out with, how would you feel? So confidentiality was vital to my mind because it brought in some concept of equality. And then I recall there was one event where orphan in one of the largest orphanages in Bombay, in Andheri, the child was brought in the night. It was a thrown child by somebody, they got it from the police. They tested, because this was a protocol then. They tested and found that the child was positive. So nobody in the entire orphanage was willing to even provide feed or touch the child. So I was asked that you go and do whatever intervention. Those were very early days. So I moved in, went there, I tried to handle that situation, and they got that confidence, so everything went okay. Then I thought we should be looking forward to such things happening repeatedly. So I got all the orphanages together, tried to teach them, because these children, since HIV was a taboo word then, so such children will increase and it can be really bad. So, and that stopped. One of the major achievements was that I could stop. In Bombay, no such thing happened after that. This was a story of 1990. Then subsequently, Dr. Pauri, who was director of National Institute of Virology, she had retired and she had come to Bombay. She used to run a magazine. Magazine in the sense, some kind of a semi-journal kind of a thing. So she used to love me like crazy. typical Parsi lady. Half the time she would be in abusive language mode. तुमने ये नहीं किया, तुम ये नहीं करा करके. She once said, "Why don't you come with me? There is a candlelight march." Ab I told you I come from a Jilla Parishad Marathi school background. Candlelight march, I couldn't understand what do you exactly mean. She said, "No, come with me." We went to Matunga or what? Lakshmi Udyan, no? In the center, Matunga, I suppose. It's in Matunga. There we went, and suddenly she said, "Now you are going to see men having sex with men. They come here. This is a cruising spot." Since that time, the disease was known as a disease of men having sex with men. So people used to attribute a lot to their advocacy. So there I went. When I met those people, my first reaction was usual orthodox person's reaction. ये कैसे लोग हैं ये क्या कुछ फायदा नहीं है, ऐसे कैसे रह सकते हैं लोग. And during the process, in that candlelight march, since you are under peer pressure, somebody will come and touch you, you start realizing, अरे ये तो normal है, ये अपने वैसी है, बात करता है, अपने वैसी ही बात करता है. His preferences are different. Is he trying to force those preferences on you? No. But they are not accepted at all. No. Not accepted to a tune which will shock you. Just imagine oneself becoming oneself as a hijra, no? Or transsexuals or whatever you might say. No? Even transvestite, those who wear only saris when they are on the street to show off their sexuality. Just imagine somebody is sick, he wants to get admitted in the hospital. Where would you admit that person? In male ward? In female ward? Where would they go to pass urine? No? Male toilets, female toilets? No clue. Look at their fight within. Their body may be belonging to one particular sex that was assigned by God, but their minds are against it. So they are constantly fighting. Who am I? Am I a male? Am I a female? Those issues suddenly become important. And then I said, it is time all of us have to realize that we have to empower people. Try to see that people treat them as equal human beings and bring them to a level which we should always have. The next thing that happened in Bombay was Pauri took me to लांब होते का
अभी 5 मिनिटात थांबवणे प्रश्न कर
विचारा 5 मिनिट में मला सांगा
लगेच सांग.
She took me to a Catholic group's ethics conference. There, because Bombay has all kinds of Catholic schools, it's a bastion of Catholic here. So there was the issue of condoms came up. The moment you talk of condoms, they started saying, no, this is not allowed in our religion. But she was little aggressive in her speech when she started arguing, whereas I used to take them, in a manner which was more logical. The result was, at the end of the day, I was told that you are the only person who will go to our schools and teach children of 9th and 10th standard on sexuality. We don't want them to succumb to this particular infection. You are allowed to speak about condoms because we think you don't try to hurt our religious feelings, but you come out with statements which can be acceptable. So I used to teach every Saturday. Even when I came here in 1993, I was in Pune. But every Saturday I used to go and teach in Bombay schools where people never had any access. Government did not have any access to those people on sexuality or whatever. But I covered almost 117 such schools, Catholic schools. That was blessed by Cardinal Pimenta, who ran for Pope's post subsequently. He used to openly in public, he used to say he is the only person we accept. I was even allowed to train their fathers and nuns in their formations. You know, they used to have it in, they have formations in Lonavala and in different places. But they are the best people, because if something goes wrong, people will come and confess things in front of them. If they confess, they should be armed with the knowledge, they should know what to speak about. So that's how we went. And then on it was all, I was forced to come to Pune, because I had established a very big name in Bombay by then. So they started National AIDS Research Institute in Pune. And my Director General, he is also here in Pune now, Dr. Tripathi. He said all those who have been working are transferred to Pune. We never had transfers, because our appointment orders never mentioned transfer. So I said, how can you transfer? He said, no, I am transferring you under public interest. Which means if I say no, I will have to walk out of the employment. I was a little shocked. He asked me, your parents stay in Pune, why don't you go back to Pune? I said, the reason is simple. Pune is known for its culture. आपण मराठीत म्हणतो ना, सांस्कृतिक, महाराष्ट्राचं सांस्कृतिक शहर म्हणून. What will I do here? I want to work in the field of HIV. What will be here? But you would be shocked, within 7 days' time, within a year's time, we established a cohort. I used to work from Gadikhana, the Dr. Kotni's clinic. Within a year's time, we showed that Pune had the highest incidence. Incidence is rate of occurrence of new HIV infections in the world at that time. And then I said, where is the culture? It is ignorance over culture which tends to prevail the worst way. And then it was my life, because I had sex workers just behind, men having sex with men, hijadas. Here the population used to be different of HIV infected people. There used to be hotel boys, waiters. Rich people used to insist, you come somewhere else and see us. So we used to go near NIVच्या बाजूला. There is a hotel kind of thing, that used to be there, where there were only trees और चाय मिलता था वहाँ. तो फिर उधर उसको बुला के देखने का, क्योंकि they never wanted, they used to come in posh cars, they have tea, show and go. So it was fun. That's how I started working in the field of HIV.
So adding to Sir's instrumental contribution of HIV in general in India, this has led him to be awarded with Padma Shree for his contribution in AIDS and SIV research. And from the stories which Sir has been telling us, I think one thing is for sure, not majority is always right. If you want to break taboos, you need someone to take the first step, so others will follow. So these are the days when nobody was talking about HIV AIDS in the country, and when Sir started working in 1980s. And since we are talking about it, he also mentioned about children in orphanages who were infected by HIV. Sir has also been a pivotal figure in starting prevention of parent to child transmission program for HIV in the country. And a lot of ideas about how to eradicate, eliminate HIV overall are stemming from his research. So, sir, as we conclude our discussion with HIV in general, can you tell us where is India currently standing and how far is the journey?
That's a little tough one. I think COVID has hit us badly.
Okay.
Second thing is the social lifestyles are changing. The reason I am saying this is because in our times it was sex work driven epidemic. So you had to focus more on those who sell themselves for sex. But now it could be anybody. Now that's very tough. Worse still, there is invisible sex work that is occurring. People want to earn more money. You have mobiles, so they will contact one another. There are platforms which are there on internet where you can actually access anybody. Like Grindr is one of them. So reaching out to them is a very tough thing, because you do not know who that person is. The person could be staying in the next flat here, but you have no idea what the person is doing. Though medicines are extremely powerful, today I can tell you that no patient, if he takes medicines on time, is likely to die due to HIV. But still, the infection rates continue to be higher, death rates continue to be higher because the stigma is still there. And the stigma is a layered thing, no? Stigma could be that I have many partners, I am an invisible sex worker. Whether female or male, it doesn't matter. Now, if people come to know that I am like this, they will stigmatize me. If I am found as HIV infected, I could be stigmatized. So I don't go for testing. I come late, and then I am in the end stages where other diseases decide the fate whether you can survive or not. So where are we? In terms of numbers, we have come down. I recall in 1990s, the prediction by WHO was India would have 4 crore HIV infected individuals by 2000. But it was our approach which was entirely different than the world. We focused on sex work driven or key subpopulation driven outbreak, and that worked very well, unlike the rest of the world. So today you have close to about 24-25 lakh people who are infected. All this is possible because of antiretroviral therapy, the medicines that have been developed. You have to remember that HIV's challenge for scientific community was the best. So everybody was attracted towards working in the area. So the best of the brains at that point in time, or almost even now until COVID, actually are from the field of HIV, in terms of research outputs. And now they are diversifying. Now today people are working on aging at a very rapid rate because HIV tends to lead to premature aging. So how to ensure that people don't age? Which medicines can we use? It is going in an advanced manner altogether. So they moved in different directions. Antiretroviral therapy, first antiretroviral therapy was approved in 1994. It was very costly. It used to cost about 40,000 rupees per month in India when it came in 1998. I was at Hopkins. I was forced to go for MPH, which today I can say I am, because of Hopkins training, what I am. But at that time I felt it was a punishment. Johns Hopkins is one of the world's best universities in medicine. And when I came back, I actually, to be honest, I did not want to go because my fear was if I go for 1 year, I will have to take my family. And if I take my family, by then I had two children, a daughter and a son. I said, if they start saying in the end that we love USA and we don't want to come back, then I am dead. What do I do? I don't want to help others. I have to help my own country first. Then I will go whatever I have to do elsewhere. And while coming back, I stayed there for 1 year. I did not know anything about cooking. ते बायकोनी रुचिरा म्हणून एक पुस्तक मिळायचं ते हातात दिलं होतं आणि तिने 2 ठिकाणी फक्त बुकमार्क लावले होते. एक जिरा राईस कसा करायचा आणि दाल फ्राय कशी बनवायची. त्याच्यावरती मी पूर्ण 1 वर्ष काढलं. तेवढंच मला येतच नव्हतं काही. तिने प्रेशर कुकर दिला होता बरोबर. पण I survived. When the collaborator asked me, would you like to work on some project we should write? I said no. I will do what I have to for my country. And I came back and started developing a protocol on mother-to-child prevention of mother-to-child transmission. And there were reasons why I chose that. The reason was, everybody used to say, these people are sinners. Why do you want to save their lives? No? Let them die. But we had to break those shackles. No? How do you break that during advocacy? I said the best group to get support is pregnant women. No? Because the infection can be transmitted to the child. When it comes to women, one of my papers I showed that majority of the women who acquire HIV infection is because of the sexual behavior of their husbands and not them. They don't know anything. So then suddenly I said mother-to-child transmission would be a good idea, and nobody could stop me at that time. So first we did zidovudine based study, then nevirapine based study, and in 2002 we launched prevention of mother-to-child transmission program in the country. Nobody, no NGO stopped, nobody. No, it was something which was a unique thing, because even for NGOs, majority of them, they tend to be very emotional. No? For pregnant women, they couldn't say anything. They stopped saying anything. The result, we could go ahead and do that part. Then I used that trick subsequently for free ART programming. That is free. The government used to say we spend 30 rupees per person per year. Now here we are talking of treatment which has to be provided lifelong, and the treatment cost is extremely high. Now what do we do? So I used an opportunity where the then health minister, Sushma Swaraj, she had lost election in Bellary against Sonia Gandhi. She wanted the best program to be developed in health for Bellary. And I was walking around in National AIDS Control Organization trying to get back to the airport. Dr. P.N. Joshi saw me. He said, "अरे आप इधर आए हैं?" मैं आया हूँ, अभी मीटिंग खत्म हो गई, जा रहा हूँ. तो he said, "अरे मेरा एक काम करो ना यार, मैडम को बना के देना है, मैं कुछ लिखा हूँ, वो उसमें और कुछ डालना है तो देखो." मैं काम करूँगा, मेरी फ्लाइट गए तो भी काम करूँगा, लेकिन मैं जो लिखा है उसको डिलीट मत करना. अरे इतना पैसा हो कौन देगा, ये प्रैक्टिकल लॉजिस्टिक्स नहीं, उनको डिसाइड करने दो. And that document had a free antiretroviral therapy program and everything. The thought process was simple, that if there is a precedence that you provide it in Bellary, it will happen all across. No? You have to choose your opportunity and try to hit as early as possible. Use that opportunity. You may fail, no? Though it may sound as if everything I did, I won. No. Probably wins are far too few, but they are significant. So we should be happy, not look at losses, but wins itself. Now where would we go today? Today, would HIV be AIDS be eliminated by 2030, which is a goal, may or may not. But is it going to increase dramatically? That none of us can say. Because you have to remember, even substance abuse is increasing dramatically across in India. When we say substance abuse, you must have heard names, crude names like cocaine. Now these people are, they are using different chemicals, no? So that has increased across in the country so much that there are people who believe that there tends to be what is called as chem-sex, no? People tend to take those medicines, to take those chemicals and tend to have sex. And they don't know anything, so protections are hardly ever used. So there is I would not say significant risk, but there is a theoretical risk that it may hit back again. So one has to be careful. Groups like you have to work hard among your communities, of your own peer groups. Speak about it, try to change their ways of living. Life is so beautiful. One needs to take care of it. That's very, very important. We lost one major battle. So I think she is from empowerment group. No?
I'm trying to.
She's part of my empowerment.
I was at Nari, and our dream, there was one guy called as Dr. Jana. He used to exclusively work in sex work in Sonagachi in Calcutta. He became world leader in female sex workers interventions. Unfortunately, we lost him in COVID. He used to be representing sex work related interventions because both of us used to love working in socially challenged populations. I focused more on men having sex with men and people living with HIV infection. And we worked so hard that even one of my friends, Dr. Thakur and me, we used to go take these women, sex worker women, to start their own interventions. Because these are illiterate women, they can't even read, write, those who were brothel based. And no language is same language for them. They come from different language groups. The result was we used to take them into churches. The sole reason why churches, because they used to provide free rice and dal. And none of us had that kind of money. And this was not Nari project. So we were doing it as our own passion. And they used to provide place to stay. We started empowering them. And we had developed excellent network in Maharashtra, Karnataka and Tamil Nadu and a part of Andhra. But then the money started affecting. Bill and Melinda Gates people came. They started offering 22 lakhs for intervention of 1,000 sex workers. Now there we fall short. What we tried to empower them to lead their own way, because we don't like the concept of gatekeepers. Gatekeeper is always benefiting. I strongly believe that if you want to eliminate any infectious disease, you have to ensure that community is mobilized. Community actually should own that intervention. It is for their own betterment. But as younger generations people, you must also know that we did that fairly well in the beginning until I suppose 2020 or so. But later things started changing. What was the best example? Best example was COVID. We had to mobilize community. Community is mobilized. But just look at me now. I am the only one who's carrying the mask. It is not to show, but if I find somebody is having, let's say somebody is coughing or appears sick, or I am in a larger group, I could acquire COVID. You look at the travels that occurred right after COVID, they were revenge travels, no? Because for 3 years you could not move out, so now I have to do this. But this is not a good thing to happen. No. If you want, no, where did we fail? This was fear-driven pandemic. No? The response was more fear-driven. If it is fear-driven, then in those cases, the adherence to it tends to last for a shorter period of time. But if it is knowledge-driven, where you understand the implication, things can be different. People can follow it well. That has not happened. That's something which remains as a challenge. Groups like you, those who want to work in the communities, must try to think how can we ensure that their adherence to change in behaviors, safer behaviors, continues to be there over a period of time. That's something which we have to do.
I'm also struggling with this because when we saw the data started to suggest that the poorest countries who did not implement any lockdowns and the richest countries who did not implement any lockdowns, because the richest countries were 100% educated and aware and it was knowledge driven. And in the poorest countries, in any case, they didn't have any resources, so they had left it as a responsibility to the people. At the lowest incidence of death rates. So this was a real, should we have been driven by fear and try to superimpose all kinds of funny agendas on people?
No, it was not fear until the time I used to take all kinds of pains to explain why they should be doing this, how they should be doing this. The reason was they have to understand. Yeah. And the biggest challenge that was there at the time when people never wanted to sit at those press conferences.
Yeah.
The sole reason was none of us knew what we are handling. But Supreme Court gave an order that every citizen in the country has a right to know. And therefore those press conferences, press briefings used to be until the time the questions are exhausted. You don't say, अच्छा बस मैं 4 सवाल लूँगा और चले जाऊँगा. वो नहीं कर सकते थे. वो ये करने के लिए क्यों ज़रूरी पड़ा था?
But that really helped because in those 6 months we saw everything, untouchability, social ostracization.
No. I will tell you what happens. The issues are so diverse, unless somebody asks you, you cannot explain everything.
Right.
And there the communication, to be really honest, it used to be so bad. I had never handled press so much in my life. Nobody wanted to go from the science side. So I was forced. My Director General said, you go and do whatever. I said, but then you have to give me an autonomy. I don't know what question they are going to ask. So I will not follow any traditional line. I will decide whatever is there, I will tell them honestly and I will get away with that. He allowed. But the biggest fear that I used to have, please remember we are a very big democracy. We are known as argumentative Indians. You use one incorrect word in a press conference, everybody will pounce on you. And this you have to handle day in, day out for as many hours as press people wanted to, was a tough task. But in the process what happens? The press was not you. All those people who used to sit there were not with a science background. Everybody had to focus on COVID. So they used to ask things which came to their mind. And you cannot deviate and say, now today we will discuss on this particular topic. No, because they are not interested in listening to that. So there were some areas which were left like that. There was no way to handle that. To tune that, when Karan Thapar, I didn't know Karan Thapar who it was until the time I gave interview, and then my son shouted at me, "Do you know what you have done?" I said, "I don't know." He is considered as a destructive this thing. I said, okay. But Karan Thapar also, when he asked me, I told him, you never asked me those questions. If you would have asked those questions, I would have answered it. Now coming to the issue that you talked of, if you don't have diagnostic tests, if you don't have any treatment, when you say, you are also saying that healthcare infrastructure is poor. So even if deaths are occurring, would you know that they are not occurring due to COVID? We have no idea. No? When it comes to Western societies, no, if you actually look at developed countries, the situation was worse. No? Even Sweden, which first started with that theory that people should mix with one another so that infection, there will be a protective immunity that will come, no, and can help all of you. Even now, they regret saying that. That with that, they had to face all kinds of admissions then. Our luck was better because we were conservative, we went by lockdown because we didn't have anything. To tell you the truth, if we were to provide crocin or paracetamol for every fever, at that time we did not have, if everybody becomes sick, we could not have it provided it. The reason was very simple. The KSMs and API, the traditional powder that you see, and in order to produce this powder, you have to have key starting material. Both of them were imported from China. And China locked down in the worst possible way. No? So there were no ships that were going, nothing was happening. No? And then our fear was, how do you help the country? No, we have to ensure that the manufacturing base has to be good. Look at your, what was it? Disinfectants. Did we have them? No. Not in that quantity, like we use like crazy. You look at masks. No? Did we have those masks? No, we used to have surgical masks, even those were smaller in number. And the reality was not to be, some of the lines were booked by different countries. Because every country wanted that production. We did not have N95 masks. You wanted doctors to handle, paramedical workers to handle patients. But there was nothing as protective PPE as we say. No? There was nothing available. So how do you generate that? You have to have lockdown, and in the process, the government did an excellent job, to be honest. Everybody used to sit together. These are going to be the needs. Then the industries people you were called, they were given the task, you produce this. Production was also not very easy. You have to remember that part also. When you have lockdown, see, if there is an industry in Pimpri-Chinchwad, there could be people who may be living here. How does he go during lockdown to that place? There is nothing that is available. So even Ministry of Home Affairs used to provide passes through the collectors. No? They used to arrange for, you have to provide food to them. Who's going to cook food? No, there were no workers. It was a massive operation of its own kind that people would not believe. So in short, things happened. Did they happen perfectly? There is always a room to question as a hindsight. No? In a hindsight, you appear very wiser. But everyone, like I said, if I look at my first experience, which I told you with HIV infected individual, my legs started shaking. But in hindsight, I would have said, no, this should not have happened. But that is not the truth. You become different as you age. I think what one has to remember is reflect, but don't think or accuse others, what could have been done better. It is only for reflections for tomorrow, that next time I will not commit this mistake.
So since we talk about the briefings, what sir used to take, I read a lot of articles in past 2-3 days which were talking about you, and most of the newspapers, articles have said that this man had mastered the skill of explaining scientific terminologies in simple colloquial Hindi which people could relate to. And
My Hindi was never. They used to call him, this is Marathi Hindi. No matter what. But if you ask me, I used to think I am speaking in Bombaya language. No? But they used to, there were times, like, अभी कैसा अभी याद नहीं आएगा 79 is 79 89 गायब 89 को क्या ऐसे इतने खतरनाक टाइम आते थे कि जब क्या बोलना है समझ में नहीं आता. It was fun.
As we move towards the last part of the discussion and then we can open the forum, since we are a policy think tank or shaping these public meetings, I have one question that all over the world it's usually said that your public health or healthcare systems need to be preventive in nature. And when I read a few research articles, they were stating that India's public healthcare is more inclined towards curative approach. So what do you think that which kind of approach will be leading India towards better healthcare management or better public health management, or are we on the correct track right now?
Are we on a correct track? As I said, you have room to improve, perhaps far more than you can imagine. When it comes to curative services, they sound very, very nice. When you take them, you may be in pain, but you don't want to remember that pain when you are normal. There is something which we have to remember: when you are healthy, you never think of miseries of admissions, pain that people can feel, or the risk of death that could exist. Even if I tell you the risk is so much, why would people jump into a running train or jump down? Why do they do that? Because when you think you are healthy, when you don't suffer with any symptom, you tend to forget or neglect the preventive aspect. Are we on the right track? Preventive aspects are extremely important. For one thing which I would strongly support the government is for the wellness centers, the yoga that has been given primacy. Now the government has started talking about it. Why? Because these are effective things, but we don't follow it unless there is a governmental support. Things have started changing in that direction, which is a very good thing to happen. But more often than not, it is like investments, where we say visibility should be there. रोड बन रहे हैं, अच्छा हो रहा है. एजुकेशन पे खर्चा करने को बोला किसी को तो वो दिखेगा, किसी को नहीं दिखता है ना. या हेल्थ के ऊपर खर्चा किया तो किसी को दिखेगा. सो पीपल विल बी रिलक्टेंट टू स्पेंड मनी ऑन सच इश्यूज विच आर बेसिक नेसेसिटीज. पण रोड किंवा फ्लायओव्हर टाकणार किंवा मोठी कुठली तरी ट्रेन सुरू करणार, त्याच्यावरती those are visible things. So you are happy doing that. Same happens with us. When you follow a routine, let's say you go to yoga classes, you learn something, you may follow it for a month or two. After that you start giving up because those results are not appreciated by you. They are only appreciated when perhaps you may start falling sick. You should have done it in the past, because all of us are wise people in hindsight. So you will find therapeutic things are necessary for survival, but prevention has to be given primacy. When can it happen? It can happen when the health literacy or literacy about your body system's functioning is known well to every individual. Today in COVID, one of the things which I used to keep on telling myself, that perhaps this is the only time when we can make a difference in people's life. At least people will understand that infectious diseases are not caused by a sharp, but they are caused by the organisms which are invisible. No? Even that much of understanding to be brought up requires a huge effort, because people didn't have concept. I used to openly say, even if somebody is from any good engineering college, he is a graduate, ask him where is spleen, he will not be able to say that. Ask him where is kidney, no idea where it is. No, it's a sad thing. That gradually has to come from primary education that starts at primary level, but you could also start at a higher level. To my mind, that bifurcation, you can drop biology and go to mathematics, is rubbish. Let everybody have small component of biology all through, otherwise you will never be able to do that. Third thing is, you have to make people realize that they are responsible for their health. Today, everybody feels I have crores of rupees, so I go to a hospital and my patient dies, or patient appears not to be improving. They will go and hit that doctor, वो तो hospital तोड़ डालो, उसको कुछ करो. ये क्यों? क्योंकि वो understanding ही नहीं है. ना उनको सबको ये समझना है कि health and diseases are a challenge for everybody to fight, including doctors. But that is happening because of ignorance, which must stop. I think all of us have to work together to try and start education, not only for those who perhaps are easily capturable, but those who are even out of school youth. Because we will continue to have disparity between genders, between rich and poor for sufficiently long period of time. And just imagine a family head who is completely ignorant and others are knowing but they cannot implement. So it has to start at all the levels. And that can be done by few motivated people. To me, if you ask me, if God would have had given some way to become young, I would have made a difference in some other area. I would have started in a new direction. So there is nothing. It's up to you. You may spend one day a week, one day a month towards a cause that doesn't benefit you, accepting your psychological benefits that could accrue to you, but you are trying to help others, improving something which you are expert in. It's not necessary that you should be expert in every area, but try to improve that part. India needs you. Because it's such a huge country, there are so many gaps. 100 years down the line, we will still be struggling to cover the gaps. Why should it not be the day when you start? No? And it starts only as a motivation when you are younger. No? Once you have a whiff of money, when you see independence, perhaps you are unlikely to come back to that area unless something goes wrong in your life. That could hit you and start back. But it would be healthy mentally that all those who have passion in whichever area try to go for some improvement without looking at what would be monetary benefits of the same.
So thank you so much, sir. And I was extremely excited to interview him since I have seen Vaccine War. And I'm so grateful that all other doctors whom we approached have said no for the program, and finally we could reach you. And I'm also very grateful to Nari for giving me the access to approach you and ask you for this talk. And I think there are a lot of areas which need to be addressed even by the students who don't come from scientific community. And your definitely the entire experience that you shared showed that everybody has something to contribute. It's not like you should be a medical professional, you should be the one who understands science, but you should be the one who has that awareness about a responsible citizen, that how I can contribute my part to my country. So thank you so much, sir. And now I open this forum for our audience questions. Due to time crunch, we have only 10 to 15 minutes.